So our patient presents today with a right SI joint sprain. She is a 24-year-old recreational skier, also goes to gym, weight room, etc. Regularly. What this happened was on a lateral step up, so she stepped out and got a significant pain in the right glute. It was fairly sharp at the time, continued with the workout, and just kind of carried on, and then the next day sought care from a physician for pain. Presentation on the first visit was significant decrease in range of motion, significant pain. SI joint sprain was confirmed, and there was a bit of there's some pelvic hypomobility as well, and lumbar spine hypomobility. Hip range of motion was full and clear, and the L4, L5 was the facet. Previous treatment includes glute med strengthening or single leg step ups, some mobilization work, just mostly self-mobilization for pain and a little bit to work on the range of motion. SI joint is still quite painful to palpate and painful with some movements, but no swelling or obvious deformity is present.
So this is the patient's fourth visit. Current pain levels is currently a 4 out of 10. So it's still a little bit tender for Mo said to touch. The pain is a bit achy feeling, but it's a little bit less localized now in the fourth visit. She's not currently taking any more meds since the pain has been manageable. But she still can't do any loading. She still can't do any running as well. Going up and down stairs, as we found, were okay for her. However, she did feel stiff, especially in the morning. It got a little bit easier throughout the day. But then when she became inactive a little bit, and that's where she started to feel it, especially when she's been sitting for long periods of time. Her current exercises have been okay, but the patient compliance hasn't been that greatest. Current findings, there's no anterior tilt on the pelvis anymore. Glute and glute medius are still weak. Core is still weak, and hip range of motion is still full and pain-free. So in order to manage patient's pain, we're recommending her to ice since this is the fourth week. Pain levels down to now 4 out of 10 from the initial 8 or 7 out of 10. So she was just markedly decreased. Yes. So we are telling her to ice the area, especially the tender area, which is currently experiencing pain, especially after these exercises, with ice for 20 minutes. Adding compression would probably help alleviate some of the stress on that joint, and also make the ice a little bit more effective as well.
So our first treatment is going to be traction for the lumbar spine. Our basic goal is going to be, again, to open up the joint spaces and just make things move a little bit better. It's going to target mobility and also pain relief, and this is a good precursor to a lot of the other treatments. Contraindications of congenital deformities and anything like that, disc issues, have all been sort of ruled out. So for the patient, all we ask is that you just let me know. You should just feel like a nice stretch, no pain. If you feel pain or any symptoms going down your limbs, let me know and we'll stop. And what I'm going to do is just kind of hook you in. So the belt is kind of tucked right up under the knees, and then I'm going to kind of put it around my back, and then just snug it up there. And all I'm going to do is just lean back and just pull traction and just watch where I see the pull coming from. We want it to come from the right at the lumbar spine, not from the knees, not from the hips, and not from the SI joint. Our parameter is going to be a 5-second hold, 5 seconds off, and we're going to go for 30 repetitions. So any questions?
Should I feel it?
Yeah, just in your low spine, just like a nice pulling sensation, like a stretch. Okay? All right. So we're just going to lean back and pull for 5, 4, 3, 2, 1. And then off a little bit for 5. And then back and for 5, 4, 3, 2, 1. That's a feeling okay?
Yeah.
Good. Just like a nice little stretch there. Good.
Just like a smooth stretch.
Good. You'll feel taller after that, I promise.
I hope so.
5, 4, 3, 2, 1. And that's pretty much the treatment there, and you just do it for a total of 30 repetitions.
So the next thing we're going to do is address the L4, L5 hypomobility that we found at the first assessment.
Okay.
So that's the vertebrae kind of around your SI joint here. It's not helping you with the pain and the range, so addressing the hypomobility will help you with all of that.
Okay.
So what we're going to be doing is applying grade 3 mobilization around that area. Okay?
Okay.
So what you're going to be feeling is you're going to be feeling a little bit of a force going from the back and going down to the table. Okay, so I'm just going to palpate along your lumbar spine here.
Okay.
So palpate for L4, which is right here, and then L5 is right just below. Okay, so I'm going to put my thumb right over the spinous process,
Okay.
the eminence with the hand, and then you're going to feel a little bit of discomfort, but the pain should be 4 out of 10, and anything exceeding that is not acceptable. So just let me know when it does that. You should also not be feeling any pain in your glutes, legs, toes, and feet.
Okay.
Does that make sense?
Yeah.
Okay, and then also let me know after the first set, if the pain kind of goes away or if it lingers around. What we want is for it to go away.
Okay.
Right? So we'll be doing this for 30 seconds, 2 to 3 oscillations per second, and then a 30-second rest for 4 sets.
Okay.
Okay? You should feel the pressure right now. Okay, that's grade 3, and I'm going to add the oscillation to 2 to 3 per second. And then we'll do it for 30 seconds, and then rest for 30 seconds, and then we'll do that, the 4 sets as I mentioned, and for both vertebrae.
Cool. So our next activity for you is going to be strengthening your glute, specifically your glute med. So kind of the smaller one on the outside, not the big meaty one on the back. So our last appointment we had you do just single leg step up. So you stepped up, nice and slow, hold, and then you just step down normally.
Yeah.
What we're going to have you do this time is you're going to step up, and you're going to go nice 1, 2, 3. I want you to hold there, nice balance, and then go down for 1, 2, 3. What I don't want you to do is let your hips shift or drop or twist or rotate and kind of bend through the trunk. I want that movement to come from the glutes and sitting down through the knee. Okay? Any questions on that?
I think so.
All right, let's give it a try.
Okay. Should I have my hands?
You can put your hands on your hips. That's kind of where I tend to put them, or you can have them out just to balance.
Okay.
So stepping up. So just step up a little slower, hold, and then go down. So kind of just go up for a 2 count, hold for a 2 count, and then go down.
Okay.
Again on that 2 count. 1, 2, hold, 1, 2, and step down, 1, 2. Good. Now I just want you to work on keeping that pelvis level. So when you keep, you're kind of shifting toward like dropping the hip.
Okay.
So keep your hands and use the mirror. Keep your hands on your kind of hip to keep them nice and level. And if you see one drop, then you have to shift and correct it.
Okay.
So try again.
Oh, sorry.
No, that's okay. If this is too challenging, we can modify. Better. And down for a nice slow movement. Good. Much better. So that's kind of where I want you to stay. I really want you to focus more on the down count at this point. So you're getting good on the way up.
2. Okay.
And then step
1,
down.
2.
Much better. Your hips are staying nice and level and your trunk is doing that. And you're getting that nice movement through the knee. So I want you to do this 10 reps, 3 sets every day if you can. And this is going to really help that glute strength, which is going to stabilize your pelvis and your SI joint.
Okay.
Any questions?
No.
Good.
I'm getting the hang of it.
Yeah, looks great.
Okay, so the next part that we're going to address is something that's very important is neuromuscular control. So not only at like your SI joint, but kind of all the way around, because that's kind of what's holding your upper body, and then also, you know, for your legs as well.
Okay.
So I'm going to get you to lay down on your back, knees slightly bent, 45 degrees, and you know how last week we addressed your core.
Yeah.
So all I want you to do, put your hands there, fingers again there, around that area we showed you last week.
Okay.
And then activate your TA.
Okay.
Just let me know when you've done that.
Got it.
Perfect. Now what I'm going to get you to do is you're going to make sure your shoulders are nice and flat on the ground. You're going to be shifting your leg that way, nice and slow. And you don't have to go very far. Okay, as far as you can go. And then kind of slowly bring it back up. So what I want you to really focus on is not the speed, but control. So how this is going to be helping you is it's going to help you enable you to stabilize all those muscles, your core, your glutes, to help you out, make sure that it doesn't kind of re-injure that area again and suddenly jump again. Okay, so nice and slow. So maybe like count to 5. 1, 2, 3, 4, 5. Nice and slow. 4, 3, 4, 5. Okay, so I want you to do that. So 1 rep would be left and right.
Okay.
So I want you to do that 10 times.
Okay.
And do that 3 sets. Okay.
Sure.
So really focusing on that, making sure you control. Again, activating that core. So everything is stabilized up here, and everything is kind of contracting here as well to control that movement. Okay. And so the next one we're going to do is working on your balance. And the balance is a really key important as well, since you do recreational skiing, right? So a lot of the core is right here, and your stomach is cluttered all the time and shifting.
Yeah.
You want to make sure that everything here is stable as you're kind of going downhill. Okay. So we're going to need a rolling chair.
Okay.
Preferably you want to be close to a wall. Okay. So I'll be right here, close beside you.
Okay.
Okay. So check your wall. So you're going to put your knee on a stool.
Okay.
And you're going to lift your leg up. Okay. Try to stabilize, look straight that way. And then, so that's going to be working your hip joint right here to stabilize, so we're acting forces because the chair is unstable and it's kind of moving around.
Okay.
Okay. So you raise it along. Okay. Hips nice and straight. Okay. As best as you can. And lift off. If you can only do it for 3 seconds at a time, that's fine.
Okay.
Okay. Is that too much?
No, I think it's okay. Just kind of gotta get nice under here.
Okay.
Low.
Perfect. Yeah, that's a little bit better. Okay. So slow. Let's lift off. 2, 3. Okay. And down. Okay. And again. 2, 3. Down. Okay. So you want to do that. So if you can only hold it for 3 seconds, that's okay.
Yeah.
Okay. But our goal is to get you to like 30 seconds of holding that. But it's okay to just start out because you are currently injured, so we're going to rework and teach that area how to properly stabilize your joints. Okay, so do that for 3 seconds each and 10 times if you can.
So the next thing we're going to work on, I'm going to do it with you, is we're going to work on our posture. So posture is something that is really important for everyday life, but it's kind of hard to know if you're in good posture or not. Because it's more than just kind of pulling your shoulder blades back and whatever else. So what we're going to do is we're going to have you standing against the wall, about your feet 6 inches away. And what you're going to do is just lean back. And then just take a kind of inventory of where you're sitting. So is your pelvis against the wall? Is it the top of your glutes? Is it the bottom of your glutes? Your shoulder blades? What have you. So next thing we're going to do is we're going to correct everything we've done. So first of all, to correct your pelvis, we're going to do just a little bit of a tilt. So you're going to tilt it forward. Yep, good. And then you're going to set your shoulder blades. And we don't want a big flare up the rib cage, we just want a nice tight rib cage, so engaging those TAs again. And then you're just going to pull your head back into the wall, like you're giving yourself a double chin. So that's the way it's going to be. I'm just going to check your back here. You've got a bit of a curve here, which is good. Again, a little bit of a curve here in the neck, which is good. And your shoulder blades are sitting nice and flat against the wall. Good. So now all I want you to do is step away from the wall. And try and hold that. How does that feel?
Weird.
Yeah, it's going to feel a little bit weird because we're not used to firing these muscles this way. We're used to sitting with our heads forward, or our pelvis tilted forward or back, or whatever else. Especially with your injury, we want to just make sure everything's stable. So addressing it from the head to the toe. So I want you to do this a few times a day, and the more you do it, the easier it's going to get. So at first, I just want you to set against the wall and step away and hold it for about 30 seconds.
Okay.
And then I want you to do that again 3 or 4 times. I'd like for you to build up so that you're setting against the wall, you're checking everything, you're taking your inventory, you're fixing it, and then you step away and you take a few steps and hold that posture. And as we progress, I want you to do more and more steps. Okay, does that make sense?
Yeah.
Perfect. Let's do that one more time. So again, you're going to fix your pelvis. Fix that little rotation there. Get that lumbar spine nice and rounded there. Good. Now your sternum, your core, shoulder blades, and then your neck. Excellent. Now just take a little step away. Still feel just as weird?
Good.
You look great though. All right, any questions about that?
So do you have any concerns or questions regarding how everything's going?
I was just wondering about running, because I usually run with my dog in the daytime or in the morning, and I just wonder if that's something I should be doing, or if it's kind of ready for that yet.
Well, as you know, you still have some pain with loading your joints, especially constant repetitive loading. So I don't think it's a good idea right now.
Okay.
However, you are progressing really well, right? So your pain's going down, you're reacting really well to treatments, mobility-wise. Now we've added some strength stuff as well, right? We progressed that as well. So I think within a couple of weeks, we can revisit that idea.
Okay.
You can still walk with your dog. As far as running goes, you can also go to a pool and do some water running. So that way it alleviates some of that stress when you're just running without water, right? Because you're floating a little bit. So that might be a good progression. So we can progress you to dry land after a week or so, after some water running. How does that sound for you?
Sounds good, yeah.
Okay. And then as far as preventing any injuries, again, avoid that running part, repetitive loading as well, all that kind of like extension and jamming that joint, because your sacroiliac joint, the SI joint where you sprain, kind of closes in. And then also you have that hypomobility in your L4, L5, right? So extending that joint will kind of close that as well, making that a little bit more painful. So avoid those activities as well. Of course, don't let anyone hit you, I guess, on that area.
Sounds good.
Still a little bit tender. So again, ice that whenever you can, because some of these exercises might aggravate some of the pain. However, I think it's been going really well. So some ice, 20 minutes. Again, adding that compression as well will help stabilize that joint, heal it properly, and then manage that tenderness a little bit for you.
Okay, and should I be doing exercises, all those exercises every day, or?
I think that would be a great idea. So it's
Okay.
just like what we talked about the past couple of weeks.
Okay.
And you've been pretty good at it, but you should be doing it more consistently.
Okay.
Right. So that will make sure that you're progressing to what you want, essentially, and bring you back to the hills, to the slopes, and also get you back running with your dog.
So for this patient, we wanted to work on mostly stabilization and a bit of mobility with strength. We wanted to treat the L4, L5 region to see how it kind of affected the pelvis, because the pelvic tilt was corrected already, but there was still some mobility restrictions. Based on the tenderness, we didn't feel like poking in at it would be like the best idea in the world. So we decided to treat above and see how that modified the pelvis. The stabilization was important as well, so we wanted to address the glute strength and then kind of add it in a eccentric piece so that we have that control and the neuromuscular system kind of stabilizing everything.
Yeah, and in addition to that step down as well, we wanted to address a different part, so mostly kind of like isolating that hip area, which is really important for skiers and what she does. So that hip on the rolling chair, although it might be challenging, but I think it's kind of a functional way as well, because
It's progression.
Yeah, it's functional progression, because as she's on the hill skiing, you do tend to shift your weight on one leg or one hip or the other. So that will help her, stabilize again that area, that core area, getting her with that TA activation as well, combining those pieces to a more of a functional progression as opposed to isolated things as well.
And to kind of target more goals with one treatment, like the lumbar mobility, we'll work on the mobility, the windshield wipers with the neuromuscular control, to kind of hit two birds with one stone.
Yeah, and then with her concerns as well, with what she kind of does every day and what she loves to do. Those are kind of important factors to consider as well. So we've modified running and adding that in a different medium where there's a little bit less loading on her joints, which we think is very important. So it makes her feel like she's able to run and work towards that goal of running with her dog
keep
again.
that motivation level high.
No, exactly, right? Because she hasn't really been compliant, so maybe that's been bugging her the past couple weeks and concerns. But it was good to reiterate that her pain levels were going down, and if she stuck to the plan, that she might reach her goal a lot sooner than later.
Yeah.